Hey everybody, Dr. Deom here at Hazleton Eye Specialists, 281 Airport Road, Hazel Township, PA. Welcome to another Eyecare Today. We are filming in our specialty suite side of Hazleton Eye Specialists. So you may have come into our office here in Hazleton and seen Dr. Patel, one of our retina specialists, or maybe Dr. Alarkar, another one of our retina specialists, or even Dr. Bucci, our cataract and LASIK surgeon. We are so proud to bring top-of-the-line surgical eye care to this area and all of our 5 locations. Don't forget where they are. We have Tannersville, our Tannersville location, which is called Stroudsburg Eye Specialists, located conveniently on Route 611, right behind Friendly's, right down from the Tannersville outlets. We have our address there, so please check us out in Tannersville at Stroudsburg Eye Specialists. Huge selection of frames. Of course, we have Dr. Bellinger there, who is a Pocono native, growing her beautiful family there. Dr. Olzinski, who's been with us for quite some time. He's just a wonderful doctor, kind, gentle spirit, just a wonderful doctor, fantastic clinician. And Dr. Kislin is there 1 day a week as well. We also have Dr. Cody, who is a retina specialist who comes with extremely high regard. He went to Dartmouth and Yale. Just a really smart guy and a fantastic clinician. He's a retina specialist, and he's also in our Stroudsburg office. So if you're in the Pocono region, don't forget us at Stroudsburg Eye Specialists, located in Tannersville. One of our newest offices, and I'm just thinking geographically, one of our newest offices is called Bangor Eye Specialists, and Bangor Eye Specialists was developed some 20 years ago by Dr. Christopher Noack, who is a Lehigh University graduate and went to the Pennsylvania College of Optometry and is currently still practicing with us in the Bangor location alongside of Dr. Corinne Bellinger, who's also in our Stroudsburg office. And we're going to be very excited to be announcing, probably on our next show, 2 new doctors who are going to be joining our practice at that location, maybe even one other here in Hazleton. And so we're excited to be, again, bringing some young doctors and young professionals to the community, support the community on many different levels. So in Bangor, you know, not far from Bethlehem, not far from Wind Gap, Rosetto, really beautiful area, and absolutely fantastic office as well. Another fantastic office, one near and dear to my heart because I go there every Tuesday, and that's Pottsville Eye Specialists. Pottsville Eye Specialists was really built on, you know, a need in the Schuylkill County area that wasn't being met. My wife's family, originally from the Schuylkill County area, called Mount Carmel, knew that there was a demand there, and so we are really excited to have Pottsville Eye Specialists now in its 5th year, growing every year, and both in patient base and also in staff. We now have our specialty suite open in Pottsville, our downstairs, where we have 5 new exam lanes, and we're seeing patients for retinal specialty care with injections and laser in office, as well as cataract preoperative evaluations by Dr. Frank Bucci right in Pottsville. Conveniently located, beautiful parking area, easy access, right in the cute little town of Palo Alto. A lot of the locals call it Pally, and we like referring to it as Pally also. So check us out in Pottsville. The Skook, we love it there. It's absolutely fantastic, and we're having a great time. Last but not least, of course, we have Nanticoke Eye Specialists, and Nanticoke Eye Specialists, you may recall, was started by Dr. David Evans, a mentor of mine who unexpectedly passed away a couple of years ago, and now we have Dr. Alexis Wylam heading up our office in Nanticoke. We're open 4 days a week, soon to be 5 days a week in Nanticoke, and we also have specialty care, retinal care in the Nanticoke office. So one thing that brings all of these offices together is that there is not a day that goes by where I don't talk to someone who comes into the office and says, "Doctor, I am coming in because I am having chronic headaches." Chronic headaches. One of the biggest reasons people come in to the office. And did you know headaches that happen on a daily basis affect more than 45 million people? Extremely high cost to our healthcare system and our level of productivity because it affects the way we function in any given day. And so when you think about headaches, it is almost inherently, built into our psyche to think about our eyes, because our head and our eyes are inextricably connected and function one and of the same. And I'll often say to patients, did you know that your brain in any given moment is 60% dedicated to some aspect of vision? So that means that of every ounce of energy that your brain is putting out, 60% of that ounce of energy is going to some aspect of vision. So it makes sense that we're part of the headache care delivery team. And so historically, what we would do when it comes to headaches is do a very thorough evaluation. We would check your eye health. We talk about your medicines. What kind of medicines are you taking? What kind of care are you receiving for any healthcare conditions that you may have? We're going to check your blood pressure. We're going to ask about your current healthcare team and have you spoken to them? And then we're going to do a comprehensive eye exam. We're going to look at the front of your eyes. We're going to look at how your eyes are working together as a team. And then probably most importantly, up until now, we were going to look at your prescription. So whether or not you need glasses, what we would refer to as the refractive analysis of your eye, looking to see, are you blurry? Because if you're blurry, your brain is unhappy. And if your brain is unhappy, there's a likelihood that some of that headache may be, at least in part, attributable to headaches. And so we'll ask questions like, when are the headaches happening? How severe are the headaches? And then make a decision as to whether or not spectacle correction with a prescription could help. On the other side of this break, we're going to talk a little bit more about headaches and some other things that could cause symptoms in and around your eyes, and a new and exciting way we can treat it. Hey everybody, Dr. Deom here. Again, another Eyecare Today. We are so excited to be talking to you today about headaches. We're going to talk a little bit about some other symptoms. We're going to talk about headaches first and how headaches could be associated with your eyes. And so we talked a little bit before about how if we're seeing blurry, how that can disrupt or interrupt the normal activity of the brain. And so again, our brain is, sort of the powerhouse of our body, the executor, the driving force between our motor actions, our thought, our emotion, and our well-being. And so, when it comes to our brain's function, we want to, I always say, give it good energy. We want to give it good food. And the best food for the brain is clear vision. And so again, historically, when we thought about good food for the brain and clear vision, we wanted to do a very thorough, thoughtful analysis of vision through checking for glasses. So, we sit you behind the 4-opter, we say which is better, 1 or 2, and we come up with a detailed, individualized prescription for you. Then another really important piece of the puzzle is we'll bring you out to the front of our offices and introduce you to one of our lovely opticians who will then pick a frame or possibly contacts, but a frame to sit that prescription in. And very important is the measurements of that lens in front of your eye in those frames, because we may see differently out of those lenses if they're not sitting where they're supposed to. One of the reasons why it is so important when getting glasses that they're tried on your face, and that there's measurements made with those frames on your face prior to the prescription being made for you. Because again, even a centimeter difference in the way that lens sits on your face can have profound effects in the way you see, and ultimately, again, getting that food to the brain. But there's another aspect of vision that I think is often missed, and that is how our two eyes make one image. We've talked about it here on the show before, because we are big advocates of what we call binocular vision, a big fancy word that means two eyes working together as one to create one beautiful image in our brain. And so, if you just hold your finger out in front of you and close one eye and look with the other, you'll see the finger moves slightly, and it moves slightly because our eyes are separated by space on our face. We have this thing called a pupillary distance. That is the distance between our two eyes. So our brain has to take an image that's here and an image that's right next to it, as seen by the other eye, put them together, okay? So it's always having to put two images together, and as things move, the muscles of our eye are going to keep the two eyes in sync with one another so that our brain can still interpret those two images as one. Now, there's tolerances built into the system, and those tolerances have to do with the clarity of the two images. So if one eye is very blurry and one eye is very clear, the ability to put those two things together may be out of tolerance. The other thing is if one eye is looking slightly askew. In other words, if there is a misalignment of the two eyes, that may also create a misalignment or an out of calibration for the two eyes to work together as a team. So this can create an issue with the brain creating that one image. And so I want to talk real quick about how the eyes move. And so there's 6 muscles that control each eye. So you can see here in the picture how there's the eye and then the 6 muscles that move the eye. And so each one of those muscles has a job that's unique and specific. And so as we look and follow something, or as something is approaching us, or even as we're moving, there's a delicate balance of direct control, conscious control of our eye movements, and subconscious control of our eye movements. The conscious control is what we think of. The subconscious control is what's happening that is often directed by our vestibular system inside of our ear. So if I tilt my head, my eyes go that way. If I tilt my head this way, the eyes go the other way. And that happens without me thinking about it. And it happens because of my inner ear talking to my eye muscles and that control happening. So again, there's tolerances, and those tolerances allow for us to see one. Now, what happens when the tolerances are strained? The tolerances, when they're becoming strained to the point where they break, we see double vision. But not many people walk around the world seeing double vision. If they do, hopefully you get in here right away and allow us to help find out why that is. There's many serious reasons why someone could be experiencing double vision. But if the tolerance is not broke and we're not seeing double vision, but it's strained, it can result in symptoms. And that is one of the most misdiagnosed reasons for headache that we now know is very, very common. And so this is called trigeminal dysphoria. Trigeminal dysphoria, we now understand, is one of the most common reasons contributing to headache. And it's one of the most common reasons that we see patients coming into the office with unexplained relief from over-the-counter medicines or other forms of care for headache. And so one of the things that we can now do with extreme sensitivity and specificity is measure someone's eye alignment. So as I'm looking out at you on your couch at home, relaxing, watching me, my eyes are straight ahead looking at you. Now, when I look down at my finger, you'll see how different my eyes look. Again, looking out at you, looking down at my finger. Looking out at you, looking down at my finger. So you'll notice that the alignment of my eyes has changed. I went from here to here. And that requires effort and energy on the part of my eye muscles. And the other thing that's important to know is that for each and every one of us, almost every single one of us, our eyes will have a resting place. So if you had x-ray vision and you could look through my eyelids and see where my eyes are sitting, they would actually be out just a little bit. That's where our eyes rest. So right now my eyes are resting out. And as I open my eyes, they come together to focus on you, which causes energy and effort. And then they need to work even harder to look up close. Just imagine, what kind of things do we do up close? Our phone, our books, our tablets, our computers, almost 80% of our day, close to 8 hours on average, is looking up close. And so again, if those tolerances are strained, and we have a misalignment in our system, not to the point where we have double vision, we're going to get a constant stimulation to the brain as a result of that. We're going to talk about how we now have a way to fix that on the other side of this break. Hey everybody, Dr. Deom here on another wonderful episode of Eyecare Today. Don't forget all of our wonderful locations. We have Hazleton Eye Specialists on the Airport Beltway. Beautiful location in the Skook. Down in Pali, Pottsville Eye Specialists. Check us out there. Beautiful location, brand new building. Very wide selection of frames. Nanticoke Eye Specialists, lots of openings and availability. We can get you and your entire family right into our brand new setup there in Nanticoke with Dr. Alexis Wylam. Don't forget Stroudsburg Eye Specialists, one of our motherships, I would say. Fantastic location right by the Tannersville outlets. And our newest office, Bangor Eye Specialists in Bangor, Pennsylvania. Beautiful office, beautiful parking area, easy access, wide selection of frames, and just the best, most friendly staff you'll ever want to meet. And so you might wonder what's going on my head here. You know, am I in the metaverse with guy from Facebook? I can't think of his name right now. Or you know, am I playing a video game? And the answer is I'm actually doing a very specific eye measurement test. And it's actually talking to me right now. You might even hear it. But it's the newest piece of technology we have at our office. It's called Neurolens. And so on the earlier segments in this show, I was talking about headache and how a headache is one of the most common reasons we have patients coming into our office. And I talked about how good vision is food for the brain and how blurry vision can be bad and create symptoms and headache. And that was really, up until now, the only thing we could do to help people who had chronic headaches and were coming in and wanted to know if their vision was part of it. So we would get them their most accurate, up-to-date vision, which I call good food for the brain. But we said, the other thing that often gets missed is how the two eyes are working together as a team. And the two eyes working together as a team have tolerances. One is a blurry eye, and the other is how the two eyes are looking at something in space. We have 6 muscles, and if one of those muscles is working incorrectly, it may strain the ability of the two eyes working together as a team. And so we can, in our regular analysis of eyes, in the exam, look at how our eyes are focused in the distance and look at how our eyes are focused up close and determine if our eyes are working harder than they need to. And we can, in some cases, prescribe what's called prism to help people relax their eyes and allow for more comfortable viewing. But what happens with prism prescribing is, historically, when we would prescribe prism for patients, their eyes would get weak. They would get lazy. And as a result, this year you need 1 diopter of prism, and the following year you need 2, and the following year you need 3 and 4 and so on. And so historically, we did not prescribe prism unless you absolutely needed it and you were constantly seeing double vision. until the invention of Neurolens. And so what Neurolens does different is, first of all, we have a wonderfully up-to-date, technologically advanced way of measuring eye alignment. Again, we always check your prescription, very detailed examination of your eyes here at every one of our locations. Now, every time you come in, you're going to get an assessment with Neurolens. It doesn't cost anything more. It only takes 2 minutes of your time, and it's going to look at your alignment of your eyes in the distance, and it's going to look at your alignment of your eyes at near. Again, very important to see the difference between these two measurements. From that, we can come up with what's called a Neurolens value, which is a prismatic value. But here's the kicker. Here is the big, up-to-date new invention that is allowing us to use prism in a new way, and that's something called contoured prism. So you'll see in this picture how light passing through a lens creates a straight line, and how light going through a lens that has contoured prism creates this tilted or curved line. And why that matters is because now, for the first time ever, we have the ability to prescribe varying levels of prism in a lens that's tailored specifically to you and your eyes and your eye muscles and how they work. And so what that allows us to do is actually help to reduce the strain on the eyes at various distances, which is different for everyone. And it also has been shown to help to strengthen the eyes and support the eyes instead of weaken them. Again, one of the big issues we had with prism before was that it weakened your eyes. And now we actually see that with the use of Neurolens, we don't need to every year increase that prismatic values. And in some cases, they're reduced, which is just really, really exciting how that works. And so, you know, some of the big categories of folks that have been helped with Neurolens: one, headaches, chronic headache sufferers, migraine sufferers. You've been to your neurologist, you've been to your chiropractor, you've been to your orthopedic surgeon, you've been to PT, and you still are suffering. Neurolens may be for you. Now, how does this happen? How does this happen? How is it something that can help you? Well, I think about the head, I think about the back, I think about even your jaw, okay, as a house, okay? Think about each one of these areas as a house. This house is controlled by one circuit. If one area of our house is being overloaded, just think about it. You're outside and you're sitting on the deck, and upstairs somebody plugged in too many curling irons in the bathroom, and all of a sudden the lights on the deck start flickering. What happened? You overloaded the circuit in the bathroom, and now the lights on the deck are flickering. So it's the same thing inside of your head. There's a very special nerve called the trigeminal nerve that controls the sensation in our whole upper head, your back, your mouth, even your ear, and absolutely your eyes and your eye muscles. So if we're overloading our eye muscles, just like overloading the circuit in the bathroom, other areas start to become affected. And in this case, one of the most common causes is headache. Some other causes that we will hear in many cases are migraine sufferers, neck and back pain sufferers, temporal mandibular joint pain sufferers. Unbelievable, but it's true. Again, think about that faulty circuit. Overloading the system in the eyes because of a microscopic eye misalignment can cause dysfunction in other areas, and ultimately would cause referred pain. So what is Neurolens? It's prism. What is prism? It's a component in a lens. To you and to everyone else in the world, it looks like a normal pair of glasses. You put them on, and usually within a week or two, people have extreme relief. It has really been nothing short of a miracle here in our office. Our first 10 patients, 2 of them went home in tears. It's really been very exciting to offer this and be one of the only ones in the northeastern Pennsylvania region who have this. and are as passionate about it as we are. So, you know, again, it costs nothing more to get this assessment. It's part of every comprehensive eye exam. If you're somebody who's calling, you already had an eye exam, you want to just get an assessment with Neurolens, we can absolutely do that. And I think one of the other big things that people ask is, you know, what kind of guarantee do I have? We guarantee it 100%. So if you don't have the symptom relief or comfort that we, you know, thought that you would have, no problem. We could always remake those glasses as, you know, a standard pair of glasses with your normal prescription in them. So more is going to come out on this. I want you to watch our social media pages if you aren't a fan or a follower of Hazleton, Stroudsburg, Pottsville, Nanticoke, Bangor Eye Specialists. We got Facebook pages for all of them. You'll see us all throughout the community throughout the year. Come up, say hi, but most of all, make you and your family an appointment to take care of your eye health today. There really is nothing more important than vision, and we hope that you can come in, check it out, and get to know us all a little bit better. Thanks again for watching another Eye Care Today.